Hi, I'm Dr. Lily Lamb and I'm here today to answer some questions about heat stroke. Heat stroke's a medical emergency. It happens when the body gets too hot and can't bring its own temperature down, and it causes people to be very, very unwell, and it needs a 999 ambulance response. Heat stroke causes severe symptoms, so the main one to watch out for is what we call neurological changes. So that means confusion, loss of consciousness, seizures or fits. They are all signs of heat stroke and signs that someone is very unwell. Otherwise, it can cause a very, very high temperature, so typically 40 degrees Celsius or more. It can cause very fast breathing. It can cause the skin to either be extremely sweaty or stop sweating altogether. The skin can also look red. People can be agitated and irritable, and babies in particular can become very irritable. Heat stroke can happen during very, very hot weather. Regardless of whether it's sunny or not. It can occur during intense exercise. It can occur if you're in a hot building without adequate ventilation. It can occur in hot cars, and there are certain groups that are particularly at risk. Heat exhaustion is milder, but it can turn into heat stroke if not recognised and treated. So heat exhaustion typically causes people to feel very hot, and their core body temperature might be increased, very sweaty. They might have a headache, they might feel their heart racing, they're breathing faster, feeling dizzy and unwell, very thirsty. But then heat stroke is a medical emergency. It causes very severe symptoms, and if not dealt with quickly, people can become very unwell. Heat stroke and sunstroke are the same thing. Heat stroke can occur in the absence of sun. Sunstroke just tends to mean that it's occurred by being in intense sunshine. So the very young are at risk of heat stroke, and also the very old, people with complex medical conditions, people who are on medications, particularly ones like water tablets are at high risk, and people who are exercising in very hot conditions are also at risk. Yes, older adults and very young children are particularly at risk of heat stroke. Exercise absolutely can cause heat stroke, particularly when it's very warm, and you don't have to be outside in order to get heat stroke from exercise. If you're indoors and exercising and it's warm, that's a risk as well. Remember, you don't have to be in the sun to get heat stroke. You absolutely can get heat stroke without being in direct sunlight. If you're in a very warm house, or if you're in a very warm car, that can also cause heat stroke. It depends what you're doing in that warm environment. If you're exercising intensely, then heat stroke can occur very quickly, so within minutes. If you're in a warm environment and relaxing, it can take longer, so more like hours. The early warning signs are the symptoms of heat exhaustion, so that's feeling unwell in response to that hot environment. So that might be excessive sweating, rising temperature, feeling that your heart's starting to race, your breathing's faster, you're feeling headachy and dizzy and generally unwell. And they're signs that heat stroke may not be far off and action needs to be taken straight away. Absolutely, heat stroke can cause vomiting, loss of consciousness, and confusion, and they're all signs that someone is very, very unwell. All heat stroke is potentially life-threatening, which is why urgent action needs to be taken to get the person seen immediately by calling 999 and getting them the help they need to recover. Heat stroke symptoms can occur after heat exhaustion, so yes, absolutely, the heat stroke symptoms can progress on from those initial symptoms of headaches and dizziness and muscle cramps that people might get with heat exhaustion. You should call 999 because it is a medical emergency, but whilst you're waiting for the ambulance, you should do everything you can to cool that person down. So getting them into the shade, removing any clothing that you can, using a fan if there is one, or cold water. Sometimes putting their hands in cold water can be a really effective way of cooling them down. If they're unconscious, you should place them in the recovery position, and you should stay with them to make sure that they're safe until the ambulance arrives. If someone's fully alert, then you can offer them sips of water, but you do have to be very careful about giving someone water if they're not fully alert, and it would be best not to do this if there's any suggestion that they're drowsy or confused. Ice baths should only be used by trained responders, so no, we wouldn't advise that a member of the public is trying to use an ice bath, but certainly using cold water to try and cool someone down can be helpful. You can't treat heat stroke at home. You can treat heat exhaustion at home, which is the precursor, but heat stroke needs to be treated as a medical emergency by calling 999 and taking someone to hospital. It depends on how severe the case is. If it's a mild case of heat stroke, then people might feel better within a few days, but a severe case can need a prolonged hospital admission, and it can take a long time for people to start feeling back to normal. So after you've received that urgent medical care, the advice would be to rest, not to exert yourself, to keep cool, to stay out of a hot environment, to drink plenty of water, and just to give your body time to recover. After heat stroke, you should avoid alcohol, you should avoid being in direct sunlight or very warm environments. You should avoid exercise, and you should give your body time to recover and seek medical advice if you're not starting to feel better. Most people, if they get the treatment that they need quickly, won't have long-term problems from heat stroke, but if not treated, yes, it can cause long-term problems. It can cause damage to the brain, to the heart, to the liver and to the kidneys, so that's why it's so important to get the treatment that's needed straight away. Yes, heat stroke can come back more easily if you've had it before. By being aware of the risks, by making sure that you've got access to shade if you're in a warm environment, by wearing appropriate clothing that's light and allows you to remain cool, by drinking plenty of water, by avoiding doing strenuous exercise when it's very warm, so avoiding, the middle of the day when it's warmest, and also by keeping an eye on people who are more vulnerable, so young children, the elderly, people who've got lots of medical conditions, people who are on medication, making sure that they have access to a cool environment when the temperature's warm outside. Drinking water alone doesn't prevent heat stroke, but it's certainly one of the important things to do to make sure that you're adequately hydrated when the temperature's warm outside. Fans can certainly help, but they're not enough by themselves, so it's important to also have access to shade, to a cool environment, and to plenty of water to prevent heat stroke. No, sunscreen prevents against sunburn, but not heat, so it's important to have access to fluids, cool environments, and shade to prevent heat stroke.